Endocarditis, a presentation by Garrison, Anna, Emily, and Sammy. What is endocarditis? It's an infection of the endocardium, which is the innermost layer of the lining of the heart. When endocarditis is caused by an infection, it's called infective endocarditis, and there are 2 to 6 cases per 100,000 a year. Causative agent. Certain types of bacteria cause most cases, but fungi or other microorganisms also may be responsible. It's usually caused by bacteria that is found in the body on a normal basis. Pacemaker endocarditis are microorganisms that usually migrate across a broken skin barrier from an eroding battery pack or a generator pocket wound. Bacterial characteristics. Streptococcus viridans produce a green pigment when cultured on a blood agar if alpha hemolytic, gram-positive and rod-shaped, catalase negative. It's not highly invasive, but it can enter the bloodstream through oral abrasions. It's poorly classified group, and identification is not always accurate. It's found in significant percentages of dental plaque, and many species in this category are non-hemolytic, and they don't grow in 6.5% sodium chloride, and almost all species are negative for growth of bile esculent agar. Staphylococcus aureus are gram-positive and circular in clusters, catalase positive, sodium chloride tolerant, and found on the skin and nasal passageways. When growing on an agar, they are round, convex, and have a 1 to 4 millimeter diameter with a sharp border. How is this disease acquired? Microorganisms that have entered the bloodstream multiply and spread across the inner lining of the heart. The endocardium becomes inflamed, causing damage to your heart valves. Damaged heart valves or artificial valves make it easier for bacteria to take root and bypass your normal immune response to infection. Small clumps of bacteria can develop at the site of the infection, and these clumps can travel away from the heart and block the blood supply to the organs, which can cause organ failure or trigger stroke. How does it enter the body? There are several ways. By mouth, by brushing teeth, chewing food, and the risk is increased if your gums and teeth are in bad condition. Infection. Bacteria can spread from pre-existing site of infection, such as skin or gum infection, or sexually transmitted disease, such as chlamydia or gonorrhea, or needles and tubes. Medical procedures that involve placing a medical instrument inside the body carries a small associated risk of introducing bacteria into the bloodstream. Instruments linked to endocarditis are syringes, catheters, dialysis tubing, laparoscopes, needles used for piercings and tattoos, and intravenous drug use. Environmental factors. There are substance abuse and factors in the environment, such as Staphylococcus aureus, which is a member of the normal flora of the body, frequently found in the nose, respiratory tract, and on the skin. Therefore, infection can spread from skin-to-skin contact with an infected person and contact with objects used by an infected person, such as towels, sheets, clothing, or athletic equipment. And Marfan syndrome, a genetic disorder and predisposition. It affects connective tissue of heart valves, subacute bacterial endocarditis. Characteristics. You got subacute endocarditis, where signs and symptoms develop slowly, sometimes over weeks or months, and acute endocarditis with a quick onset of symptoms. Signs and symptoms. You can have common flu-like symptoms, fatigue, muscle and joint aches, night sweats, shortness of breath, and chest pain when breathing. Uncommon symptoms would be unexplained weight loss, blood in the urine, spleen tenderness, Janeway lesions, ulcerous nodes, and petechiae. Some risk factors are artificial heart valves or damaged heart valves, congenital heart conditions, especially those affecting the valves. Those with a history of endocarditis are more likely to develop it a second time, and a history of illicit intravenous drug use. Bacteria can more easily attach to the endocardium if the lining surface is rough. Acquired heart valve disorders that make it easier for bacteria to attach are rheumatic fever, which is an inflammatory illness that may follow an untreated strep throat infection, idiopathic calcific aortic stenosis, a degenerative condition seen primarily in the elderly, which the aortic valve's cusps become thick and fused and infiltrated with calcium, syphilis, scarring of the aortic valve, and connective tissue disorders such as Marfan syndrome. Diagnosis. You can have a blood test, which is the most important, and tells the doctor what is invading the body. An echocardiogram, which creates an image of your heart while it's beating using sound waves. An ECG, which doesn't specifically diagnose, but helps show if something is wrong with your heart. A chest x-ray, which shows if heart is enlarged and if infection has spread to other parts of the body, such as the lungs. How serious is endocarditis? It depends on the severity of the infection. Most people recover with antibiotic treatment if it's caught early. Several published studies have reported in-hospital mortality of 15% to 20% and one-year mortality of 40%. Untreated patients with infective endocarditis could die. Infection can lead to damaged heart valves, which leads to regurgitation of blood back through the valves and inefficient pumping of blood to the body. Treatment: you can have antibiotics such as penicillin, which are usually given for 2 to 6 weeks through an IV. Surgery, which would be valve replacement. Have to be careful of bleeding during or after the surgery. Blood clots that can cause heart attack, stroke, or lung problems. Infection, pneumonia, breathing problems, and arrhythmias. Any new treatment options? University of Illinois at Chicago College of Pharmacy is researching how bacteria that cause streptococcal infections can be manipulated. The university is trying to figure out ways to disrupt the biofilms of streptococci. The bacteria use small peptides that are secreted into the bloodstream and can turn on different genes. These peptides function as pheromones and can turn on the gene that may contribute to illnesses. They're also trying to understand how pheromones interact with the RGG proteins and how those proteins interact with DNA. They're also working to identify small molecules and peptides that specifically inhibit RGG function. Figuring out what the mechanistic basis of inhibitor function is and identifying the structural features of those compounds will lead to the development of the anti-infective drugs in the future. An interesting fact about endocarditis: our patients with infective endocarditis can present with a symptom called Osler's nodes, which is named after Sir William Osler, who was a Canadian physician and one of the 4 founding fathers of Johns Hopkins Hospital. These are our resources. I hope you enjoyed our presentation on endocarditis.